This come up repeatedly, so I'm just really interested in why you stay where you stay. There are cynics who say if you win the nomination, you're going to try to move to the center. That's what some people say. That's why you won't talk more about this. But isn't it a fact that the Bernie Sanders Medicare for All plan, which as of this moment you are on board with, right? Mm-hmm. It says quite specifically, middle class taxes will go up, correct?
So what Medicare for All describes is the kind of health care coverage we are going to provide as a country. The cost estimates on it are in lots of different places, and they vary by literally trillions and trillions of dollars depending on how this lands. The same thing is true for the revenue streams. So where I am, and I think this is the right place to be, is to say, look, here's the commitment we need to make. It's a cost commitment. And this is why I think about what it means. If you say to families, go have your health insurance, we're done with you. Yeah, you're done with them until the person I met who needed $125,000 for one treatment to save her life. And her insurance company just looked at her and said no.
Do you worry? I don't mean to interrupt.
Let's just go down the row here.
Let me quickly,
Sure.
If you can. Do you worry, though, and Mr. Axelrod lived through this,
Yes.
it was incredibly hard,
Yes.
doing something that Democrats believe to this day that you believe is the right thing to do, passing the Affordable Care Act. Things like if you like your doctor, you can keep your doctor, the American people took as you lied to us. And it made the politics harder. If middle-class taxes in your Medicare for All plan went up, well, they say during the campaign, why was she trying to be cute? Why wouldn't she just say it? And then make the argument as Senator Sanders does, but you need to trust me here. Overall, when you take away private insurance, your co-pays, your other costs, your overall costs will go down. But yes, your taxes might go up some.
My commitment is I will not sign a bill into law that raises costs on middle-class families. And I understand. Good Lord knows that President Obama had to live through this. President Clinton lived through it when they tried and lost before. That the insurance companies are out there trying to sell the message every single day that this is all about costs. And here's the deal. It is about costs. It's about the costs they're imposing on the American people when they raise their premiums, when they raise their deductibles, and when they suck tens of billions of dollars out of the system for their profits. I mean, let's stop for a minute and remember, every dollar of profit that an insurance company made last year was made by saying one word, no. No.
Yeah.
Yes, so
no to
Senator,
your coverage, no to the medical
down the row
care
if we
you
can.
need, no to the doctor.
Yeah.
Yeah, Senator Warren, you are known for having plans for everything,
Yep.
right? I've got a plan. That's what you say at all of your rallies and the debates as well. You don't have your specific plan, right, for Medicare for All. It's basically Bernie Sanders' plan that you've signed on to. Can you imagine in the coming months that you would put out your own plan that addresses some of these concerns that people have about private insurance, some of the concerns that unions have as well, and some of the concerns that people have about their taxes going up?
So I do endorse Medicare for All. I think it is the right approach for us to use. And the reason for that is everything I have seen says this is the way we can cover everyone at the lowest possible cost. I don't think we should live in an America where people can't get the health care coverage they want, especially people who have health insurance. It's not a choice to say to someone, I'm sorry, but the prescription medication that your doctor said you need is just not going to be available to you. Figure out whether or not to reach in your pocket and pay for the prescription or to pay this month's rent. And that's what millions of people are doing, some variation on that, all across this country, and it's got to stop. And as Democrats, that's the fight we should be in.
David?
Senator, as a parent of a child who had a chronic illness,
Yes.
I've tangled with the insurance
I'll
companies in
bet
my
you
lifetime.
have.
I hear your argument, but just to follow up on Nia's point, are you saying that the Medicare for All bill that is in the Senate that you signed on to, Bernie Sanders' bill, is the plan that you are running on and the plan that you will try and implement when you become, if you become President of the United States? You're not going to have your own plan. You're satisfied
That's
with
my
the
plan.
Sanders plan.
I think it's a good plan. I think Medicare for All is the way that we make sure that everybody gets covered at the lowest possible cost, and that You and a lot of people like you do not have to spend hours on the phone arguing with insurance companies only to be told no.
Can you guarantee, and I know that's a hard thing to do, but can you guarantee that what people might save on the cost of their health insurance would be more than what they might have to pay in additional taxes?
So I said I will not sign a bill into law that does not reduce costs for middle-class families.
But what about the tax part of it? That's what I'm. That's what I'm.
You just,
I mean, if there's an equation
you just
here.
heard it, and this is the point I'm trying to make, and I've made here. Families are dealing with costs.
Right.
The tens of thousands of people who come through the selfie line to me talk about their costs. And many of them have health insurance, or at least they had health insurance until they developed the really serious illness, till the child was diagnosed with cancer. And then the insurance company said, not so much. We don't want you anymore.
But if your estimates, if you say that the estimates of what Medicare for All will cost vary by trillions and trillions of dollars, how can you even make an assurance as to how this is all going to pencil
because
out?
There are multiple revenue streams. And
like taxes?
Many of them are identified already, that there are multiple revenue streams. But what we do know is that Medicare for All is the way we cover everybody in this country at the lowest possible cost. And here's the thing. Go ahead.
So you're better than I am on math and policy. So I'm not going to argue about that. I want to talk just about the politics of it.
Uh-huh.
I know people.
Mm-hmm.
People don't like to be forced.
Mm-hmm.
It sounds to me when you say Medicare for All, maybe even who don't want it, that you're forcing people. So when Mayor Pete says Medicare for all who want it, I like that. To me, it seems like you got a public health care like the public subway. Right now, to ride the subway, you'd have to be either very poor Medicaid or very old Medicare. What Pete's saying is if you want to ride that subway, you can ride it. But if you want to be in a Lyft, an Uber, get a pogo stick, or a little whatever, you can do that too. You're saying you got to get in the subway. I don't care if you want to lift a helicopter, get in the subway. Why is that good politics? Don't you think America's going to feel like you're forcing something on them they don't want?
Let me do this slightly differently, because I'll tell you how.
But isn't that a brilliant metaphor?
Let me tell you how I think about this.
Great question.
I think about this.
She didn't say yes.
No one did.
Just let the record reflect.
I think about this as we should leave no one behind in this country. And any proposal that is about, here's some Medicare, it's Medicare for people who can afford it. It's not Medicare for all, it's Medicare for all who can afford it. And that means, by definition, because we can do the math on this, it's going to leave millions of people behind. And every time somebody says, no, I'll cover them, then the question is, why isn't Medicare for all?
Well, okay, so here's the thing. You're making your argument about the people who might get left out because they're too poor. I'm talking about the people who want
too poor.
or just get screwed by some mean too sick,
or too. That's
You're
right.
looking at the folks
Their
at the
costs are
bottom.
too high.
And that's
No, it's not. It's middle class
fine.
families.
Look, stay with me now. Middle class people, poor people, that's your concern. And you say, I don't want those people to be left out. But what about the people who could opt out and want to have the freedom to opt out? Do you care about them and their freedom to opt out?
Look, what I care about is that they don't get pushed out, because that's what's happening right now with insurance companies.
Yeah,
Can we just stop and acknowledge that that's what insurance
Hey,
companies
listen,
do?
I see it every day. I see it every day.
All across this country. And I just want you to pause for a minute about what that means. I had a young man stand up at a town hall and explain that he'd been diagnosed with MS, and his insurance company refused to pay for one of his treatments. He'd started down the treatment line, and his explanation of it was that here he was, he had insurance, he fights with his insurance company, no, until he finally ends up in the public system. But understand this, he described it as, I have now a lesion in my brain that is an inch long that I will carry for all my life. And for anyone who understands about MS,
Yeah, it's amazing.
this is a deteriorating condition, and it never gets better. What you try to do is hold off. It's getting worse, and I hope with investments in medical research we get to a point where we can reverse it, but we can't right now. And an insurance company, a man who was fully insured, said, you know, we're just not going to pay for this. And so long as that is the case, what that's going to keep doing to people is they think they're covered. The woman I talked with out in Nevada, she thought she was covered right up until an insurance company said no.
Yeah.
And we can't be that America. We can do a better job of delivering health care for all of our people. And here's the deal. Understand this. Man, I'm ready to get out there and fight for it. Because where the fight's going to be in the general election is between Democrats who are fighting to make sure that people are covered across this country and Republicans who are working every single day to try to take away health care from millions of Americans. The lawsuits are proceeding, the work they're doing in the administration. Millions of people have lost their health care coverage since Donald Trump has become president. We're going to have that fight.
Yeah.
I tell you, I'm happy to be a Democrat.